The Chinese Community Health Resource Center, known as CCHRC, was established in 1989 as a community-based organization. We are committed to build a healthy community through evidence-based strategies. Our team consists of staff, volunteers, and interns. For the past 25 years, we have formed partnerships with various communities to address health disparities facing the Asian community. CCHRC has partnered with academia utilizing community-based participatory research approach known as CBPR. CBPR is about balanced powers. It is about give and take, like in any relationship. When conflict arises, we need to trust our partners and give each other the benefit of the doubt.
Partnership is a co-learning experience that empowers both parties. It involves understanding both university as well as community cultures. And this allows us to train students to understand community issues as well as how to build community partnerships.
Partnership allows us to leverage limited resources and complement each other's strengths. All relationships take effort, commitment, and trust. We may not always agree on how to get things done, but we compromise, and we learn to work out our differences to build a lasting relationship.
Community partnership provides researchers in academia a valuable social connection to the community. Sometimes we think that we may do things more efficiently on our own, but we know that community partnership brings along community trust that can maximize reach to our targeted populations.
In partnerships, I think it's important to communicate each partner's roles, responsibilities, and expectations in a clear and transparent fashion. In the past 25 years, we've gained trust and credibility from our community members, so they are comfortable and willing to share insights, challenges, and potential realistic solutions with us.
Currently, CCHRC and the Asian Alliance for Health are working with our academic partner, Yvonne, to explore ways to address violence-related issues through professional conferences and educational tools. Yvonne and I have been working together since year 2000.
In collaboration with the Chinese University of Hong Kong, Asian Alliance and Cal State East Bay is organizing a conference on violence prevention, mental health, and social work in San Francisco. Working with CCHRC and Alliance, we are addressing child sexual violence through an educational tool titled The Brave Little Panda.
The Brave Little Panda, a children's story, was designed to promote dialogue among children 5 to 8, their parents, educators, and providers on the topic of child sexual abuse. The tool was adapted into various languages and formats. You can learn more about this tool by visiting asians4health.org.
As community partners, we can function in various capacities, sometimes as the co-investigators, other times as the principal investigators. For example, in my study with Gwen on end-of-life issues, CCHRC functioned as the lead applicant.
For this project, academia played a supportive role rather than a leading role, as is traditionally done. It helped with all the scientific aspects of the study, but with community inputs. We were able to achieve an increase of almost 70% of advanced directive completion over baseline.
Janice and I have been working on tobacco-related studies. For these studies, CCHRC functioned as the community PI and co-investigator.
For our Stop Smoking projects that are internet-based or using peer-to-peer lay health worker outreach model, partnering with the community helps develop strategies that better serve and outreach our smokers. In this case, CCHRC, our partner, whom the community trusts, help us serve as a bridge to effectively reach our smokers.
CCHRC's future direction is to expand our partnership network to increase the usage of technology to address health disparities and to continue to cultivate the next generation of public health professionals.